Well, listen, it's all things health this morning, and you know what? When it comes to COVID-19, it's been a thing that's been on our lips for more than 18 months now. So for those who have experienced COVID-19, there are some long-lasting effects that we are still discovering. And since the outbreak in December 2019, now with this, the vaccine rollout progressing, we also have, the numbers have been dropping, but there are talks of a fourth wave looming. Now, those who have contracted coronavirus, they have also, however, are still affected by some of those side effects. We are now chatting with Specialist Neurologist, and this is Dr. Ashleigh, who is here to really discuss and unpack the long COVID symptoms and side effects. And if you have questions or comments, you can visit Expresso's Facebook page, post your questions over there, or you can even give us a call on 021 110 552. Dr. Ashleigh, it's so great to have you here.
Thanks. It's great to be back in Cape Town and back on the show.
And it's great to have you here, but you know what? It is also a serious topic because the long-term side effects of COVID-19 is something I'm assuming you guys are discovering each and every single day. Now, when it comes to those who have had COVID, a lot of them are struggling to this day with their breathing. My fitness coach is one of them. Okay. Now, what has from the research point of view, what have been some of the long-term side effects?
Look, COVID has been around since, December 2019. So over the past almost 2 years, we're looking at a lot of clinical scientific research, looking into the pathological mechanisms into how COVID actually causes this problem, because that is fundamental. Because if we can get down to the root problem, we can see how we can actually manipulate and try to prevent severe disease and see which patients are actually at risk of developing these conditions. So I think that much of the research has done a pretty good job thus far, but there's still much that needs to be done. And what we are now seeing is perhaps this sort of silent new pandemic that is emerging for the last, I would say, about 12 months or so. And this is what we describe as a long COVID syndrome. So patients are not fully recovering from the COVID infection as you would usually recover from the flu. So the symptoms are vast. And this is the reason why it's so difficult to treat each individual symptom, from fatigue and brain fog, memory loss, headaches, chest pain, etc., etc. But there is a lot of scientific evidence now coming out using alternative methods, and we'll discuss this in the show.
Okay, well, I'm very excited to unpack this because, you know what, when you get COVID, you have to isolate for 10 days. What is the research showing? Is that still the case? You need to isolate for 10 days? Should it be increasing, or what is the infectious time period?
No, I think the CDC guidelines still remain about 10 days to isolate. But what we are now seeing is that more patients are becoming symptomatic for a prolonged period of time, and this is the concern. So there are some mechanisms, according to the research, why this is happening. So there's a persistent, what we call a viremia. So there's active viral replication still ongoing that causes the ongoing inflammation, and that is the key here. Inflammation continues in these patients, neural inflammation in the lungs, and in fact in the olfactory epithelium causes the long-term symptoms like loss of smell, loss of taste, for example. But usually it is the 10 days, and ideally most patients would have recovered within 4 weeks.
Okay, and 4 weeks is still long.
It is still long. If you look at how many patients with the flu, you don't really, are sick for 4 weeks. It's usually 3, 4, 5 days, and then back to work, back on your feet, etc. So those are the cardinal symptoms that are sort of hallmarks of the long COVID.
Yeah. Well, Doctor, you're not going anywhere. We still have more questions and comments to ask you. And if you have one at home, please head on over to our social media pages. One of the questions I would love to ask the doctor is specifically who is most at risk for long COVID. We are continuing that conversation. If you would love to give us a call, please do so on 021 110 552.
It's my feel-good breakfast show.
Welcome back as we continue a very interesting and important health discussion. We have all felt the impact of COVID-19 on every level of life since the outbreak back in December of 2019. Wow, what has happened in the time between? With the vaccine rollout now progressing quite well, rates of infection are dropping, thankfully, and some who contracted coronavirus, however, are still living with the after effects. Now, we're going to chat right now, or continue our conversation with a specialist neurologist this morning, Dr. Ashleigh Bhanjan, to discuss what is being called long COVID. And you can visit Expresso's Facebook page to post some of your questions, or you can give us a call, 021 110 5552. Doc, thanks for sticking around.
Pleasure.
Thank you. Well, earlier before we ended our first segment, I asked you, what are some of the contributing factors to someone getting long COVID, and who would generally be most susceptible to it?
So there's many clinical studies and retrospective population cohorts that they have looked at this, because this is important, because you would want to identify those patients who are at higher at risk, because perhaps maybe increasing the vaccination count for these patients might assist them in the long term. But what we can see over a large, I think this was published in June this year, is that unfortunately women over the age of 40 that are overweight with coexisting medical conditions like chronic kidney disease, cardiac disease, cerebrovascular disease, and immunocompromised patients. So patients with cancer, unfortunately, on chemotherapy drugs. So those are the risk of patients that are seen to have a higher propensity of developing long COVID, and patients that have been hospitalized with COVID for more than a week. So those patients sitting at home who've had the isolation for 10 days are not particularly at risk, and they run about 5%, I say. Okay. But the majority, so 80% of the patients who suffer with long COVID are those ones who have been admitted for a prolonged period of time, required ventilation, and obviously developed the complications of the COVID itself, the severe pneumonias, and requiring ventilatory support. Okay. So that relates to, once again, the chronic inflammatory component of the disease.
I was going to ask, like, the why of it.
Correct.
Why this sticks around?
It all stems down to what is causing this persistent inflammation. So the virus is actually attacking these, it actually binds to a specific protein, an enzyme called the angiotensin converting enzyme, call it ACE2. So the virus is airborne, right? So it enters through the olfactory epithelium to your nose, but those receptors are found in the nose, in the lungs, in kidneys, in the brain, in the gut, lymph nodes, thymus gland, everywhere. So can you see? So if it's able to bind to these and get access and entry into the body.
That's inflammation everywhere.
Now, that is where the problem lies. So that's where now clinical research is trying to also see if we can prevent direct invasion through these receptors to prevent the virus from actually maybe reinfection, so that the patients don't get so much of viremia. And that's the reason one of the identifications is looking at primary prevention and the vaccine rollout as well.
It's amazing what you can do now that we've had time to look at the data. It's amazing.
There's still more to come, These
for sure. I know it's still early days.
So they're going to constantly mutate and try to evade our, efforts and stuff nonetheless. So, but what's persistent, we see this in clinical research, is that the patients who have ongoing symptoms have chronic inflammation. And I'll say this 10 times on the show, and I said it 2 years ago as well. It's the same thing, chronic inflammation. And what they found is that, for example, even in the nose, so the patients who have a chronic loss of taste and smell, and this can last for up to a year. And imagine not unable to taste or even smell an orange versus a lemon for up to 12 months. So there's chronic peripheral inflammation happening in the nasal epithelium that is propagating now, that's causing this ongoing. So if we need to manipulate and get the inflammation down, and that's the key.
Okay.
Just another point of origin. Yes. I love that.
Doctor, when it comes to, I know a lot of people who have had COVID, they say that their memory is not how they, how they remember it. In fact, as a neurologist, I wanted to know from you, I've never had COVID. I am double jabbed, but I'm even struggling with my concentration and memory. Is that a symptom of long COVID, or is it just something to do with this pandemic still ongoing?
Are we just tired?
Everybody is tired.
We're just tired, man.
Everybody is tired. But the chronic fatigue is one of the most common, the commonest symptoms seen in long COVID, unfortunately. And we see this across the board over the last 100 years with patients who've had, post-encephalitic syndromes with the Spanish flu, etc. So these viruses have the propensity to create neural inflammation. So this is now inflammation in the brain. So neurologists, clinicians, physicians will see a lot of patients with chronic headaches, chronic encephalitis, brain fog, and this can be, assimilated to chronic fatigue syndrome. This is the same sort of mechanism, because chronic fatigue syndrome is also neural inflammatory based. So you can see it's much of a muchness on both sides.
For sure. Inflammation.
There you go. The same stuff.
I'm going to say it again.
Yeah.
I'm beginning to actually understand now why this has had... I mean, this is a corker. This virus really did pull a number on us.
Yeah.
We are fighting back. Thankfully, we've had the collective intellectual might of the world's best minds focused on developing vaccines and hitting this head on. How does being vaccinated help you from the long-term effects of COVID or long COVID?
Graham, prevention is always better than cure, right? So if you don't contract COVID, great. Well, that's the first step, right? That's the first step. Because we don't know whether you're going to develop. And even though the studies will show that there is ongoing long COVID symptoms in patients and stuff who have had vaccines or not had vaccines, we still can't identify them. So even if you don't have coexisting medical conditions, you're not overweight, you can still develop the condition or the long symptoms, you see. So vaccinations, fortunately, yes, there is light at the end of the tunnel. Yes, so there is a reduced incidence of patients with long COVID because I guess there's some resetting of the immune system that allows the inflammation to be dampened down to some extent. So they are seeing a reduced incidence in patients who have been vaccinated in this condition.
Well, Dr. Ashleigh Bhanjan, thank you so much for joining us this morning, talking all things long COVID. And of course, if you haven't been vaccinated yet, like the doctor said, prevention is definitely better than cure.
It's my feel-good breakfast show.
Welcome back. Thanks so much for keeping it locked as we continue our health discussion this morning with specialist neurologist and good friend of the show, Dr. Ashleigh Bhanjan, who has spent the morning with us discussing the term long COVID. Yes, there is something being experienced by many that have gone through this process and the symptoms are just not going away. So we are back with a final installment to answer any of your questions. You can let us know on our social media platforms if you have any. Treatment options. But before we get into treatment options, we've got a caller on the line right now. Rilda, a very good morning. How are you? Marilda, excuse me butchering your name. Marilda, very good morning. Phoning us all the way from Gauteng. You're talking to Graham and Zoe. What's your question for the doctor?
Good morning, Graham. Good morning, doctor.
Morning.
But last year.
Oh.
So, I don't have any treatment after March. Yeah. I'm sitting on a constant basis.
It's a bit of a bad line.
The thing is, I've got
Okay, so the line is very bad, but our producer was able to get at least a bit of an inkling there. Apparently she's got an ear infection. Could be that related to COVID? Is that something that you've seen?
Yes, so ongoing viral viremia, so recurrent infections. This can be ear infections, chest infections, urinary tract infections, meningitis. So recurrent infections can be, unfortunately, one of the list of symptoms.
The gift that keeps on giving.
Unfortunately.
Is there something she can do about it?
Well, unfortunately, first seek medical attention to see if there is any indication for example, an antibiotic or drainage, for example. But I think first thing, seek medical attention and then take it from there, because recurrent infections are unfortunate in this post-COVID pandemic.
They are one of the side effects.
Well, we want to get to the treatment question, but we have another caller saying from Durban. Good morning. What is your question for the doctor?
Hi, good morning, doctor.
Good morning.
And good morning, everyone. You see, I've had the COVID infection from December last year. And throughout the year now, I've been having different symptoms that I've never had before. I've had to see a doctor for pains and check chest pains, x-rays, and I've been to a physiotherapist for about 6 weeks. And then thereafter now, of late, I noticed that I've got heightened anxiety and worry and fear.
Sure.
I just have the slightest kind of disturbance in my life. I get like a stone in my stomach. It's like I've never had this before.
Okay.
So I'm just wondering if it's a normal symptom for the long haul, you could let me know, please. Thank
Okay.
you very much.
Salim,
Thank you.
for
Great
your
question. And I have a feeling a lot of people have been
Graham, you can
feeling
answer
it.
this one.
You are
But this is the
perfectly
reality.
okay not feeling okay.
But this is our reality, and this is unfortunate because patients are going to be saying the exact same story. I've been to the chest specialist, I've been to the physicians, I've been to the neurologist, I've been to this person, that person, and if you're going to be treating symptoms of chest pain and cough and headache and brain fog, symptomatically you're not going to get anywhere. But these are symptoms of long COVID.
Yeah.
And this is all we're seeing right now. Up to 80%, guys, 80% of patients who had COVID are going to end up with symptoms like this.
Yeah, and
That's 4 out of 5.
We look at the mental toll that it's taken,
Yes.
the emotional toll, along with the physical
so
toll.
neurocognitive symptoms, as described here, mood changes, anxiety, depression, those are the neurocognitive symptoms part, and affective disorders that you start seeing now with the post-COVID, long COVID symptoms.
Well, Dr. Ashleigh, we can't end off the segment with the
Yep.
question we've been teasing the whole time.
Yep.
Yeah.
When it
Wait
comes
for
to
it.
treatment, what is available and where is the treatment
Yeah.
direction going?
Look, there's been much clinical research, scientific research, and what's now being driven is this holistic, integrative medical approach, where
makes sense, yeah.
patients, for example, are in ICUs for a prolonged period of time. They're unable to mobilize, get out of the bed, sort of perform the activities of daily living. So they're referring them to a holistic sort of rehabilitation unit where there's physiotherapists and occupational therapists, speech therapists, for example. But on top of that, we're talking about a different form of sort of alternative therapy where we talked about photobiomodulation and laser therapy in the past. And when we were back here 2 years ago, we still talked about inflammation, but that in a different context altogether. We talked about Parkinson's disease, dementia, and the link. So can you imagine now, we're still able to modulate this amount of inflammation, which have been driving the whole morning.
Yeah.
Whether it's in your nose, in your lungs, in your brain, all the symptoms.
Yeah.
So
Exactly.
if we could dampen down that inflammatory component, symptoms get better. And this is what we've seen in our clinic. So we've seen almost 100% success rate with the treatment. So patients don't have to continue visiting ongoing, specialists and doctors and stuff because you're not going to, get your sort of brain fog under control with any sort of medication, if you understand.
Yeah.
There's no medication to help neural inflammation.
Okay.
There is no
See?
silver bullet, but when you start looking at this holistically,
That's what it is, yeah.
Suddenly it all comes into focus. Doctor, thank you so much for joining us
Pleasure,
this morning.
guys.
We've covered a lot of ground. And I think the most important take-home, if you are feeling the strain, if you are feeling exhausted, you are not alone. The whole world has gone through this together. But most important thing, go and get vaccinated.
Yeah.
Yeah.